What's the targeted audience for this person? We're targeting players, arena, especially those driven by safety, quality assurance, efficiency, and those interested in patient flow, workflows, and real-time adaptation to stuff that happens in the real world. One of the first questions that we think our audience wants to understand or wants answers to is, what does ITG Labs know about the peri-op arena? What experiences do they have? Have they participated in procedures in the OR? In this presentation, we give a pretty good view about the behavior of people who play in the perioperative arena, what we know about the processes that they use, and the information that they seek in order to execute the procedures in a safe and error-free condition. We start with our experiences as Direct Data Corporation, DDC. DDC was started by two of our partners, Vic Pacheco and Warren Morrison, a long time ago, about 4 decades ago. The company introduced a database system that users could control via input, keyboard input, that represented a natural language. In our case, we used English as the language because that's what our clients used. However, the system would work for any language that was verb, noun, adjective, adverb oriented. Basically, this work was in effect the commercialization or industrialization of software developed by aerospace organizations, where we designed and built computer-based systems. Way back in the day, the clinical devices were electronic. The new clinical devices were electronic, and they were analog. And they were based on analog sensors, and they were used to display the outputs of the sensors. For instance, a timeline of EKG, a timeline of pressure or temperature, any of the vital signs. Direct Data Corporation designed and built monitors that were used in the ICUs and the operating room. The monitors displayed and recorded the outputs of sensors. Each monitor signal could be used, each monitored signal could be arranged in a normal range or an out of bounds range. When the signal deviated from the normal range, an alarm condition would be set, and the alarm could be either audio or a flashing light or something of that mode. Figure A is an example of one of the devices that we designed and built. It was usually located at a nurse's station. Figure B is an example of the operating room version of our monitoring system. And figure C is an example of an early device that was pre-iPad. It was a pad developed for mobile charting and training. Effectively, what we did at Direct Data Corporation was to build what today would be called an app that that nurses and physicians could query vital sign trends, edit RX orders in the ICU, and edit RX orders in the ICU for contraindications. Now, it's one thing to say that. It's another thing to build it. So there are three parts to it. In the center, we see the OR equipment system. To the left, we see what was on the desk in the ICU. And on the right, what we see was something that we thought would be useful, which would be a mobile device for charting and training. ITG Labs, LLC, is a spin-off of the Direct Data Corporation. Lessons learned at Direct Data Corp were primarily utilized as the basis for applications that were developed by ITG. And what the lessons were is that the clinical environment and culture is in the perioperative environment is team-based, and that for every organizational slot for the team requires 5 persons to be hired because the teams have to work 24/7 for 365 days. Those are the active hours of the teamwork. Now, especially in the ICU, in some parts of the OR activities, it may not be that much. The other thing that we found is that the culture is not technology oriented, that the apps must fit the organizational culture. And that culture is dominated by the OR committee. Having learned those lessons, ITG Labs set out to really come up with a better fit in the environment. And that was by getting 2 great anesthesiologists to become members of our team. They're Doctors Peters and Shropshire. They brought with them the perioperative culture and knowledge gained from years of experience at major medical centers. And we plan to integrate their knowledge into our applications. 5 years, the ACS, WHO, and other organizations have concentrated on improving the quality assurance, reducing errors, and lost slots in the OR. That amounts to better management of the workflows utilized in the perioperative arena. To develop hands-free perioperative control apps, we moved to really understand the workflow elements by creating models that could be adapted for specific patients and surgical prototypes, and then simulated. The research at the University of Ulm provided tools to simulate models, and other approaches were done by other organizations. to this problem utilizes the work of the University of Ulm, the Fraunhofer Institute, that was based on Ulm's Aristoflow modeling capabilities, and Lupstick, where the workflows and models of workflows in the OR got serious treatment. The next step after the modeling and simulation is to incorporate the latest recommendations from the Institute of Clinical Systems Improvement Healthcare Organization. And they post a perioperative protocol, and they keep it updated on a regular basis. And that represents something that we look for and incorporate in our models. We've learned that historically, the information such as that which is put in patients' charts is collected in a near, quote unquote, real-time manner. That is, it's near unless the situation in the OR or the ICU or whatever gets serious, and then all hands are on board to whatever tasks are required to manage the patient's problems. The data is then put on the charts later, much later in some cases, whatever people can remember. To help in these situations, we've developed a quote-unquote hands-free charting capability. And that becomes part of what we call the HFPC, or the hands-free perioperative control.